The spread of the novel coronavirus is a challenge for countries around the world. The EU member states are particularly hard hit by the crisis. But what are the EU institutions doing to contain the spread of the virus, provide medical care, and limit economic consequences? What are the heads of state and government of the EU member states doing? The heads of state and government of the EU have been in close contact with each other since the beginning of the pandemic. During the first few weeks, they regularly discussed the current situation in video conferences. It was about jointly mastering the challenge posed by the coronavirus. First of all, it was important to slow down the spread. And yes, in the first weeks, many member states, including my own home, Germany, have played single fighters and were not really working with each other. So that should give you, and all of us, a sign what has to happen in the future. But the question of how the EU can limit the economic consequence of the crisis for the European Union then came more and more into focus. On July 17th, the heads of state and government of the EU met again in Brussels for the first time since the beginning of the pandemic. At a special meeting of the European Council on July 21st, after several days of negotiations, they agreed on a reconstruction fund of 750 billion euros. The aim is for the structural instrument to come into force on January 1st, 2021, after approval by the European and national parliaments. But what is the role of the European Commission in this crisis? Well, there is something important because the European Commission has only limited competences in the area of health. In principle, each country is responsible for the organization and financing of its healthcare system. And by the way, in Germany, it's even in the hands of the states and not even the federal government. The primary task of the EU Commission is to support the member states in coping with the crisis and to make recommendations for a joint approach. It has made a major contribution to coordinating member states' actions during the crisis. This is the case in the areas of public health, transport, border management, and the internal market and trade. And just to mention, here in Germany, we had a lot of patients from the Netherlands, from France, from Italy, and so on, because we still had the capacities in intensive care to take care of others, and we did. The aim is to achieve coordinated behavior and fight the virus as effectively as possible. The European Commission is working with companies and member states to improve the Europe-wide equipment with medical supplies, including protective clothing. In addition, the European Commission has presented a roadmap for the gradual lifting of corona measures in order to enable coordinated behavior by the member states. What is the EU doing in the area of mobility? Limiting the spread of the virus is the key fact there. In view of the improving health situation in the EU, the European Commission recommended on June 11th to lift the travel restrictions within the EU by June 15th. The internet platform Reopen EU of the European Commission has been in operation since June 15th as well. The platform offers all EU travelers up-to-date information on border regulations, means of transport, travel restrictions, measures in the field of public health and safety, for example, distance rules and mask requirements, as well as other practical tips in the individual member states. In order to limit the spread of the coronavirus, the member states decided on March 17th to comply with the recommendations of the European Commission to uniformly prohibit non-essential entries from third countries for a limited period, which was subsequently extended several times. Since June 30th, the temporary restrictions on third countries jointly defined by the EU and member states have been gradually lifted again. But what was the visa policy? Member states can refuse applicants for short visas and visa holders entry into the Schengen area on grounds of a public health risk. This measure is one of the entry requirements according to the Schengen Borders Code and is a condition for the issue of a short visa. What about citizens that are stranded in third countries? In March, the European Council committed itself to ensuring coordination between its embassies and EU delegations in third countries. Since the beginning of the corona crisis, the member states have organized a large number of flights that have brought more than 520,000 people back to Europe. In addition, the EU Civil Protection Mechanism has facilitated the repatriation of nearly 60,000 EU citizens from around the world. But what is the EU doing in healthcare? The European Commission is supporting the health system of the EU member states during the corona crisis. To this end, it mobilizes financial resources and takes measures to ensure the supply of medical material. This applies in particular to the planned vaccine, personal protective equipment such as face masks and protective gloves, but also medication, life-saving ventilators and other medical aids. So, talking about the vaccine supply. The aim of a vaccine strategy proposed by the EU Commission in June is to enable access to a safe and effective vaccine as quickly as possible. Sufficient production of vaccines for all EU countries should be ensured. To this end, the Commission negotiates contracts with various vaccine manufacturers so that all EU member states can purchase a corona vaccine as soon as it is available. The European Union is pooling its strength with global partners. On May 4th, a donor initiative to respond to the global corona crisis was launched. The fundraising campaign until June raised a total of 15.9 billion euros. These funds will be used to make COVID-19 therapies, tests and vaccines available worldwide. And what about the supply of medical devices? On the proposal of the EU Commission, the European Union is building a strategic stock of medical equipment. As part of the RESC-EU emergency reserve, ventilators and protective masks, among other things, are procured. The medical material is to be used in those EU countries that need it most. The EU is making 380 million euros available for this. The EU initiative Solidarity for Health is endowed with around 6 billion euros. They support the health system of the EU member states directly. The emergency aid is intended, among other things, to help finance and coordinate the transport of medical equipment and patients, promote the recruitment of additional medical staff, and support the construction of mobile hospitals. And the European rules for public procurement offer great flexibility in emergency situations. Urgent medical goods can be purchased within days or even hours. The EU Commission has published guidelines that explain in detail how public contracts can be awarded quickly and in compliance with the rules. The EU Commission has secured the delivery of the drug Veklury during a contract with the pharmaceutical company Gilead. Veklury is the brand name of Remdesivir, the first medicine to be approved at EU level for the treatment of COVID-19. With coordination and support from the Commission, the Member States and the UK received the first batches of the drug as early as August to meet urgent needs. The EU Commission has temporarily exempted the import of medical products from non-EU countries from customs duties and VAT. This makes it financially easier to supply doctors, nursing staff and patients with urgently needed medical equipment. But what is the EU doing in the field of research? The European Commission supports research and development of vaccines, new treatments, diagnostic tests and medical systems against the coronavirus. These should be made available to all those in need. Here it is necessary for scientists to exchange knowledge and information across national borders. To this end, the European Commission has initiated various measures. One is financial support. The European Commission is mobilizing over 1 billion euros through Horizon 2020, its funding program for research and innovation. 450 million euros to develop treatments, tests and vaccines against the coronavirus. 400 million in guarantees for European Investment Bank loans to fund early-stage COVID-19 research and development, including industrial-scale production. And 150 million euros for disruptive innovations to cope with the corona pandemic as part of the funding instrument European Innovation Council's Accelerator. And also there's the EU data platform COVID-19. The aim of the new EU data platform is to collect available research data quickly and use it together. This allowed researchers to centrally store, exchange and analyze a great deal of new knowledge about the coronavirus. The data platform is part of the Commission's ERA versus Corona action plan to combat the coronavirus. It aims at close coordination, cooperation, data exchange and jointly funding efforts between the Commission and the Member States. And for this they have an expert team. On March 17th, the European Commission set up a team of experts on COVID-19. The epidemiologists and virologists from different EU countries should develop EU guidelines for risk management that is scientifically sound and enables a coordinated approach. Based on scientific advice from the European Centre for Disease Prevention and Control and the team of experts, the European Commission published initial recommendations for community measures and test strategies on March 19th. Recommendations on health system resilience followed on March 30th. Lothar Wieler, president of the Robert Koch Institute, and Christian Drosten, head of the Institute for Virology at the Berlin Charité, are members of the advisory team from Germany. What is the EU doing for the economy? The federal government is in constant contact with the European Commission and the governments of the EU member states in order to coordinate measures for the economy. And there's a reconstruction plan for the economy. A recovery fund is necessary for the phase after the acute fight against the coronavirus pandemic, and that's the recovery phase. Its structure was negotiated at a special summit of the European Council from July 17th to July 21st. The 27 EU heads of state and government agreed on the so-called Next Generation EU Development Instrument. It is endowed with 750 billion euros and embedded in the reshaped EU budget. 390 billion euros are to go as grants and 360 billion euros are loans to particularly affected member states. The agreement also includes a clear commitment to the rule of law and the protection of the financial interests of the EU and its member states. The aim is for the structural instrument to come into force on January 1st, 2021, after approval by the European and national parliaments. And there is the solidarity package. The European finance ministers had already put together a package of measures with a volume of more than 500 billion euros on April 9th. This aid program is based on 3 pillars, which were approved by the heads of state and government on April 23rd in a video conference of the European Council. First, it's support to businesses through the European Investment Bank. It is intended to support small and medium-sized companies in the financing of upcoming tasks on a large scale. Second, it's support for employees. Creation of a Europe-wide instrument to finance short-time work, and that includes SURE. I made a video about this recently, about the 87 billion euros. And it's not only SURE, it's support mitigating unemployment risks in emergency. That's the long version of SURE. And 3, support for the states that are particularly dependent on it through the European Stability Mechanism, which was created after the financial crisis in 2007-2008. And there's immediate action. To help people and the economy, the Commission had already launched extensive emergency measures. With the investment initiative to overcome the corona crisis, the European Commission is making available a total of 37 billion euros as liquidation aid for the regions within the framework of the EU Structural Fund. There is also a package of measures by the European Investment Bank. It mobilizes funding of up to 40 billion euros. The EU Commission applies the EU budget rules flexibly so that the EU member states can make necessary expenditure to combat the crisis. The EU Commission opens the EU Solidarity Fund for the corona crisis. This will give the most affected member states access to additional support of up to 800 million euros. The EU Solidarity Fund can now be used not only in the event of a natural disaster, but also in the event of a public health emergency. The EU Commission has issued a temporary framework for state aid that makes it easier for member states to support companies with grants, loans and guarantees. The ECB is launching the PEPP, the Pandemic Emergency Purchase Program, for 750 billion euros to combat the economic consequences of the corona pandemic. And if you are interested in more videos about European or global politics, here's a button to subscribe to my channel so you will know when I publish another video. And if you want to see one right now, YouTube has chosen another of my videos right here for you on the end screen. I'll see you in my next video. Click and enjoy. Viel Spaß!